everyone, welcome back to Analyze with Casey. Before we dive in, I want to share what inspired today's episode. I recently heard from someone returning to the radiography field after being away for several years. They're preparing for their ARRT recertification and feeling a little overwhelmed, and they said one of my videos helped them. They asked me to look into one critical area, image quality, specifically what factors affect receptor exposure, spatial resolution, and distortion. And that's when I knew we needed to make this video. Now here's the cool part. Everything we're about to talk through actually comes straight from an ARRT chart used in CQR and board exam prep. This one right here. This breakdown is gold. It shows how things like mass, SID, OID, motion, and grid use affect each piece of image quality. And we're going to walk through it row by row with examples, pop quizzes, and tips you can apply at the console or on your next exam. So whether you're brushing up for the ARRT CQR, studying for your boards, or you just want clearer images and fewer repeats, this one's for you. Let's get into it. Before we dive into each individual factor from the ARRT chart, let's start with a broad overview of the 3 pillars of image quality. So as we break down the chart, you'll know exactly what we're aiming to control. Receptor exposure, aka your image brightness. This refers to how light or dark the image appears. Too little exposure and your image is underexposed. It looks pale or grainy. Too much exposure and you've got a ghosted out mess with no diagnostic value. Think of it like photography. If you don't let in enough light, your photo turns out dark and useless. In radiography, the light is your X-ray beam and your receptor is the camera sensor. In clinical terms, exposure is primarily impacted by mass, KVP, SID, grids, filtration, collimation, and the anode heel effect. Next up, we have spatial resolution, aka sharpness or detail. This is how crisp or clear the image is. Can you see the trabeculae in the bone? The sharp edges of soft tissue? That's spatial resolution. If receptor exposure is brightness, then spatial resolution is your high definition versus your standard definition comparison. The higher the resolution is, it means the more accurate detail and the fewer repeat images you'll have. Things like OID, SID, focal spot size, motion, and alignment can make or break spatial resolution. Lastly, we have distortion, aka shape and size accuracy. Distortion refers to anything that changes the true size or shape of the anatomy. If something looks stretched, squashed, or shifted, that's distortion at play. It's like a funhouse mirror. The anatomy is still there, but you can't trust its appearance. That's dangerous in diagnostics. SID, OID, patient positioning, angulation, and pathology all affect distortion. So now that we know what we're trying to optimize, let's see how well you remembered them. Quick check-in. Which of the 3 pillars are we talking about? Which image quality factor is most impacted by motion? A, receptor exposure, B, spatial resolution, C, distortion. The answer is B, spatial resolution. Motion blurs the image and destroys sharpness. Question 2, what happens when SID increases? A, exposure increases, B, spatial resolution decreases, C, distortion decreases. The answer is C, distortion decreases. The more SID, the less beam divergence and the less distortion you have. Question 3, if an image is too dark, which pillar has likely been affected? A, receptor exposure, B, spatial resolution, or C, distortion? The answer is A, receptor exposure. Exposure directly controls image brightness. Okay, now that we've warmed up, let's zoom out just a little bit before we go line by line. Instead of tackling each factor one at a time, let's first group them by the image quality pillar they affect, so you can see how these concepts cluster together in real-world practice. Let's look at the factors affecting receptor exposure. When we talk about receptor exposure, we're talking about how much radiation is hitting the image receptor. So anything that influences beam intensity, beam quality, or scatter cleanup is going to show up here. Here's the list. Mass, the more photons, the more exposure. KVP, the more penetration, the more exposure. SID, the more distance, the less exposure. Grids clean up scatter but absorb the primary beam too. Tube filtration. As it filters out low energy photons, there's less exposure. Beam restriction, tighter collimation, equals less scatter reaching the image receptor. Your anode heel effect. The beam is stronger under the cathode side. Patient size and pathology. The more mass, the more attenuation, and the less exposure to your IR. The key takeaway here is the receptor only knows what hits it, not what you meant to send it. So controlling these factors is crucial for image brightness. Next up, factors affecting spatial resolution. Spatial resolution is all about detail clarity. They're the factors that make an image crisp or blurry. OID, the more distance, the more blur. SID, the longer the SID, the better sharpness. Your focal spot size, the smaller it is, the sharper your image. Motion, that's the sharpness killer. Your angle, if it is misaligned, then you're going to get a geometric blur. And your patient size and pathology. Scatter from larger patients can reduce sharpness. Think, anything that spreads out the beam or causes movement degrades resolution. Lastly, we have the factors affecting distortion. Distortion's when the anatomy appears on the wrong side or it's the wrong shape. These are your distortion culprits. OID, the more OID, the more magnification. Your SID, the longer the SID, the less distortion you have. And your angle, if your tube part and your IR are misaligned, you're going to have shape distortion. Lastly, your patient size and pathology. Conditions like scoliosis or fluid can alter the shape. Here's an easy rule. If your image looks stretched, squished, or weirdly shaped, distortion is likely to blame. Now that you've seen which factors belong to which pillar, the patterns start to emerge, right? SID and patient factors show up in all three. Mass and grids are only about receptor exposure, and motion only impacts resolution. This is a great mental map to keep in mind. Let's test what's stuck. Question 4. Which factor affects all three pillars of image quality? A, grids, B, SID, or C, motion? Your answer is B, SID. It impacts exposure, that's your distance, resolution, that's your sharpness, and distortion from magnification. Question 5. Which of these factors affect receptor exposure, but not resolution or distortion? A, focal spot size, B, grid use, or C, OID? The answer is B, grid use. Grids clean up scatter and reduce exposure, but they don't affect sharpness or shape. Question 6. You notice the anatomy looks stretched on your image. What's the likely cause? A high KVP, B, angulation or OID, or C, grid cutoff? The answer is B, angulation or OID. Both can lead to distortion that changes how anatomy appears in shape or size. Nice work. Now let's take that momentum and apply it to how factors show up in clinical practice. So you know what you're expected to control, what you need to work around, and what's just built into the equipment. Factors you can directly control as a tech. This is your mass, KVP, SID, OID to some extent, depending on the patient positioning, your focal spot size, your beam restriction, that's your collimation, your tube angulation, part alignment, motion, you can minimize this by patient instructions or your exposure time. These are the tools in your hands every day. If image quality is off, these are your first suspects. Next up, patient-dependent factors, body habitus and pathology. Motion due to a condition or pain, OID, especially if you're imaging over devices, casts, or trauma setups, distortion from deformities or positioning limitations. These require adaptation. You may need to change technique, positioning, or expectations, but they're often out of your direct control. Next up, we have equipment-based factors. Grids. You choose when you use them, but you can't change their design. Tube filtration. That's set at the system level. Your anode heel effect. That's built into the geometry of the tube. Detector characteristics like pixel size and matrix resolution are more relevant to digital processing. These are important to understand, but not something you adjust in the moment. They're part of the system design or manufacturer specs. Let's look at the frequency of use. Every exam, you have an opportunity to adjust your mass, KVP, SID, motion, OID. Then we have often adjusted items like your beam restriction, grids, and tube angle. Then we have our rarely adjusted. That's only changed when needed. Understanding what you use all the time versus what's situational helps focus your studying and your workflow. You may have noticed the note on the ARRT chart, grids include conversion factors. What this means is when you use a grid to reduce scatter and improve image contrast, you're also absorbing some of the primary beam. To compensate, you must increase your mass using a grid conversion factor, or GFC, also known as the Bucky factor. Here's a quick reference. If your original technique was 10 mass and you add a 12:1 grid, 10 mass times 5, that's your Bucky factor, gives you 50 mass. The ARRT expects you to understand that grids clean up scatter, know that this lowers receptor exposure, and you compensate by increasing mass. Using these factors, this is high yield and absolutely testable. Heads up for test takers. If you're preparing for the full ARRT board exam, you should definitely memorize the most common grid conversion factors. They're fair game for the technique compensation and dose adjustment questions. However, if you're studying for your CQR like I am, it's more important to understand the concept that grids reduce receptor exposure and that you'll need to compensate by increasing your mass. The exact math is helpful, but not strictly required for the self-structured assessment. All right, now that you've seen how these factors operate in real-life imaging situations, you're ready for the deep dive. Let's go factor by factor and connect the dots between the chart, the clinic, and the exam. First up, mass. This affects your receptor exposure. It controls the quantity of X-ray photons. More mass, more photons, more receptor exposure. Say you have an underexposed image, boost your mass. Next up is KVP. This affects your receptor exposure. It controls the penetration power of the beam. The higher KVP, the more exposure, but also the more scatter. Here's a tip. KVP impacts both brightness and contrast. Only receptor exposure is charted. OID, this is your object to image distance. It affects spatial resolution and distortion. The more OID, the more magnification, the decreased resolution, and increased distortion. Here's a tip. Get the patient as close to the IR as possible. Your SID, this is your source to image distance. It affects all three pillars. Increasing SID reduces magnification and improves sharpness, but also decreases exposure. Here's a pop quiz cue. Which factor affects all three pillars? SID. Focal spot size affects spatial resolution. The smaller the focal spot, the better the detail. Larger, you have more unsharpness. Clinically, this is used when detail is critical, like in extremities. Grids. This affects receptor exposure. Grids clean up scatter, but also absorb some primary beam. You must increase mass using the GCF, the grid conversion factor. We covered this earlier in the script. Next up is our tube filtration. This affects our receptor exposure. It filters out low energy photons, reducing patient dose, but also reducing exposure. Here's a tip. The higher the filtration, the harder the beam, and the reduced image contrast. Beam restriction. This affects your receptor exposure. Collimation reduces scatter and patient dose, but excessive restriction can reduce receptor exposure. Picture an open versus tightly collimated light field. Motion. This affects spatial resolution. Motion creates blur. Use short exposure times and immobilization to reduce it. Here's a tip. Patient education can be your best tool. The anode heel effect affects receptor exposure. The beam is stronger on the cathode end. Place thicker anatomy under the cathode side. Here's a mnemonic. Fat cat, fat part under cathode. Patient factors. Your size and pathology affects all three. The bigger the patient, the more absorption you need and the more technique. Pathology can increase or decrease attenuation. Here's an example. Osteoporosis uses less technique. A pleural effusion needs more. Your angle. This is your tube part and your receptor. This affects your spatial resolution and distortion. Misalignment can cause elongation, foreshortening, and affect sharpness. Here's a tip. Keep tube-part IR alignment consistent. All right, that's our full through the ARRT image quality chart. Let's hit a few wrap-up points and test your knowledge with a few more quick quizzes. Here are your key takeaways. Receptor exposure is all about the number of photons reaching the image receptor. Spatial resolution is the clarity and sharpness of detail. Distortion changes the size or shape of the anatomy. Factors like SID and patient size, pathology affect all three pillars. You control more than you think, and understanding each factor helps reduce repeats and improve diagnostic quality. Let's finish with one more round of review questions. Question 7. What is the primary reason for using a small focal spot size? A, to reduce patient dose, B, to improve spatial resolution, or C, to reduce distortion? Your answer is B, to improve spatial resolution. Question 8. Which factor increases magnification and decreases sharpness? A, decreased OID, B, increased SID, or C, increased OID? Your answer is C, increased OID. Question 9. What does adding a grid do to image quality? A, increased distortion, B, reduced contrast, or C, increased contrast and reduced exposure? The answer is C. It increases contrast and reduces exposure. All right, that's it for this deep dive into image quality. If you found this helpful, please consider liking the video, dropping a comment below, and subscribing for more ARRT prep, radiology breakdowns, and data science and healthcare. I'll see you in the next episode, and until then, peace, pixels, and proper positioning.